In my facial bone contouring consultations, I see a wide range of patients. Some come in with vague concerns like my face looks too big and wide, or simply I want to be prettier, without understanding what facial bone contouring surgery actually involves. On the other end of the spectrum, some patients come in with very specific demands like I want zygoma reduction without removing any bone, or I'm concerned about genioplasty with T-osteotomy because it breaks the bone into too many pieces, essentially trying to dictate the surgical technique themselves. From my point of view, having to give a diagnosis, neither situation is advisable. For those who have too little information, I end up spending less time discussing really significant information because I have to explain everything from start to finish. On the flip side, when patients come in with an overload of information, consultations often take longer because they may have misconceptions about the procedure. So I want to talk about things that you should consider before having a consultation with me. Things to know before coming to the facial bone contouring consultation. First of all, you should think about what kind of face shape you prefer or like. Consider your personal style and what would look best on you. Think specifically about the changes you'd want to make to your own face. Consider what features you might alter if given the opportunity. Beauty itself is a very subjective concept. You've probably been in conversations where you mentioned how attractive you find certain celebrities, only to have your friends completely disagree with you. On the other hand, they mentioned someone who was very handsome, but you didn't find them attractive at all. That's completely normal. When we talk about attractiveness beyond just being pretty, beautiful, or handsome, the concept becomes more nuanced. That's why having specific standards is so important. I suggest bringing several celebrity photos or digitally edited images of yourself to our consultation. The more photos or information you provide to me, the clearer my understanding of what you want becomes. This helps me better assist you with your request. Please don't feel shy or embarrassed about bringing celebrity photos. You might think, isn't she too pretty to be my goal? Or, does this face shape suit me? Don't worry about whether it's possible or suitable for you right now. When we have a consultation together, I will tell you about those details. By thoroughly discussing your goals and desires, bridging the gap between doctor and patient understanding is the most crucial part of the process. We should be spending the most time there. Terms to know about facial bone contouring surgery. Well, I want to tell you about what facial bone contouring surgery is. Looking at this image, we can divide the outer face line into 3 sections. The first section is modified through zygoma reduction, the second through mandible contouring, and the third through genioplasty, chin surgery. When we adjust all 3 areas, the zygomatic bone, mandible, and chin, we call this a total contouring operation. You might be wondering about the difference between facial bone contouring surgery and orthognathic surgery. Some people think they're the same, while others believe orthognathic surgery is more advanced and complex than facial bone contouring. These are 2 completely different surgical procedures. Orthognathic surgery is designed to fix issues like mouth protrusion or prognathism and involves moving your teeth. Facial bone contouring surgery, on the other hand, doesn't involve any tooth movement at all. Mandibular canal and plate fixation are terms you often hear when researching or consulting about facial contouring surgery. The mandibular canal has 2 openings, a mental foramen at the front and a mandibular foramen at the back. The inferior alveolar nerve exits the brain and travels through the mandibular canal. If the facial bone is cut beyond the canal, it can damage the canal and cause sensory disturbances in the teeth and lips. Therefore, the bone should not be cut beyond the canal. It should serve as the boundary line for facial bone surgery. When it is necessary to secure bone fragments, titanium screws and plates are used in a process known as plate fixation. Don't worry, these titanium components aren't magnetic, so they won't set off airport security alarms or cause problems during MRI scans. For reducing the cheekbone, zygoma, surgeons typically use one of 2 approaches. The first is called ostectomy, where they remove part of the bone and reposition what's left. In this case, the zygomatic bone is rotated or pushed up, leading to a reduction in its volume. The other is called osteotomy, where the facial bone is separated and relocated to the backside without any bone removal. These 2 techniques are used for different purposes, but I often combine them during surgery. When reshaping the jawline, I reduce the angle using a curved ostectomy technique and narrow the width through corticectomy or alternative methods. For genioplasty, there are also 2 main ways to operate. For chin reshaping, genioplasty, I primarily use two approaches: T osteotomy, which specifically narrows the chin width, and inverted V osteotomy, which effectively reduces chin length. While many other surgical techniques exist, they're basically variations of these two main methods. I'll select the most appropriate technique, or combine multiple approaches if necessary, to achieve your best possible outcome and ensure optimal results. Once again, you really shouldn't be spending too much time thinking about the surgical methods involved. I will work with you to provide a solution that perfectly suits your needs and ensures the best possible outcome for your situation.